So we're gonna go ahead and get this seminar started. So number one, I'd like to thank everybody who's on. This is our first time actually doing this seminar, so we might have a little hiccups here or there. So just want everyone to bear with us for our first live webinar. And I'd like to thank Dr. Ryan Peters for being our guinea pig today.
Yeah.
So there you go. Perfect. So I like to, like I said, I'd like to welcome everybody to our first seminar. It's called New Year, New Feet, Building Healthy Foot Habits for the Year Ahead. I'm your host, Dr. Adam Teichman. I'm with PA Foot and Ankle Associates here in Allentown, Pennsylvania. We're a podiatric surgical practice with about 5 offices in the valley. We treat everything from runners to weekend warriors to people who have complications associated with diabetes or any other type of foot or ankle elements as well. And we are accepting new patients. And I'm really excited today to kick off our 2026 by focusing on one of the most overlooked yet critically important aspects of our health, which are our feet. And we're really going to focus on how physical therapy actually will, basically complement anything we do with the foot and ankle. Our feet are quite literally, carry us through life. People really don't realize how important they are. They absorb pounds of force daily through our daily activities and support our posture, influence our biomechanics, and they really play a major role in injury prevention and physical performance. Yet for many people, foot care is reactive rather than preventive, and that's what we're here today is to talk about prevention. And we tend to pay attention only when pain or dysfunction shows up. But today's goal of this session or this seminar is really to change that mindset. We'll be discussing, how footwear impacts biomechanics and injury risk. Also, the most common mistakes people make with their feet, and also hopefully develop some type of actionable steps that you can implement immediately, throughout your day in 2026. And, like I said, too, I'm especially excited to welcome, Dr. Ryan Peters. He's a doctor of physical therapy with extensive experience in movement science and rehabilitation. He's a certified distance running coach and the owner of Path Movement Health and Wellness. Ryan started his business in 2022 to combine physical therapy, performance coaching, and training into one seamless process for athletes and active adults. His mission is basically to supply others with the necessary tools to perform the activities they love for, a lifetime. Now, I read his bio, but, I met Ryan probably about, 4 months ago or 5 months ago at my grandson's birthday party, I think. And we just started talking, and I was really impressed by his practice and his knowledge base for running and activities. And I thought it'd be a nice symbiotic relationship that we can form with his experience and my experience, and really helping educate people in the community, on injury prevention and also, how to choose proper equipment for their certain activities. So, we're going to go ahead. I don't know if Ryan, you want to throw any of your input into that.
Yeah, no, thanks for the intro. I think that's spot on. Today's world of information, there's just so much out there. So, how do we quiet the noise and get down to just simple, practical things? Like you mentioned, the foot's the first thing in contact with the ground. So it's often looked at and not appreciated. So what are the simple, kind of the most easiest things that we can do to keep us walking, moving, and, pushing our own boundaries a little bit? So
All right,
yeah.
very cool. So we're going to have a Q&A at the end. So if you guys have any questions, I'd appreciate if you guys held them off till the end. And if you guys, you know, um, have any other stuff, and we are giving away, I think, a pair of sneakers for everyone signed up for the seminar. I'll be getting an email. We'll do a random drawing, and whoever gets that email or wins it will get a pair of shoes from a company called True Motion. So, Ryan, to start out, when we talk about healthy feet in the context of a new year, what does that really mean from a physical therapy and movement perspective?
Yeah, good question. Since I work with a lot of runners and, active adults who really need their feet to do the activities that they love to do, one of the things I always come back to is like motor control or coordination, like the ability to move your toes, right? That's so important for everything else that needs to happen up the chain. So just having like an understanding that, your toes are supposed to move, especially the big toe, opposite of the other four. Sometimes it's funny because we start with that in our assessment, and people are like, they can't get their brain to connect to how those toes move. So I think just understanding that, the foot is meant to have some kind of dexterity to it, and that's really important for how the function and strength and balance occurs through the rest of the foot, ankle, and up into the chain.
That's great. As podiatrists, we always say, everything starts as the foot because it's the foundation for everything that occurs higher up in the chain. Like we call it, I guess, the kinetic chain, right? Biomechanics is, I think, really the crux of a lot of issues and pathology that goes on with the foot and ankle and higher up, whether it's knees or hips. Can you touch a little about, biomechanics and really the role it plays when we talk about movement and how it can affect if that biomechanical chain is thrown off, whether it's through, something called pronation or flat feet, or even supination, which contains and sometimes contributes to a high arch. So, how's that role play into the kinetic chain and biomechanics?
Yeah, especially, I can think of a number of clients and patients I've seen who had a knee or a hip problem, and we identified poor timing or poor sequencing of that pronation supination. So sometimes there is an actual, we could call it like a deformity or a issue that's tight or stiff or limited at the foot, but sometimes it's a timing issue, just not pronating too fast or starting in way too much supination. So they're thrown into pronation so fast. So that timing, then if it's already off at the foot and ankle, well, somebody up the chain is going to have to take on some extra role here, whether it's the knee, whether it's the muscles in the thigh. And then usually, unfortunately, sometimes the side effects is now you have some knee pain, some inside knee pain, or you have some hip flexor issues that are just starting to be really tight. And it's like, your source or I'm sorry, your site of your pain is higher up, but the source is really coming from the foot. So once we understand how that sequence and timing is supposed to occur through the arch into the big toe and how we push off our foot, that's how we should really always assess, especially movement and your ability to walk, stand, balance. So that timing is so important.
Yeah, so we call that like almost like gait, right? So how your gait is going to contribute to some of the other elements that can occur. So normally doing like a gait analysis is something that you do probably on your patients as well, especially for runners, right? And dealing with runners and looking at their gait because we know that runners, one of the most common ailments that occur from running is knee injuries, and really like that medial part of the knee is sometimes where that impact occurs. So looking at the foot and the biomechanics of the foot can somehow stabilize. I think we talked about that shoe company that I helped design was True Motion, where
Mhm.
that heel locked it in the heel so we don't have any excessive movement in that heel, which kind of then disperses the force straight up the knee instead of putting it more on the medial side of the knee. So what are your thoughts on that and looking at the heel and preventing injuries such as knee injuries for runners? And I think that's going to lead us into footwear and how to choose proper footwear and biomechanics.
Yeah, definitely spot on, right? I would say in the runners and people who I've worked with, classical kind of anterior front side of the knee joint pain, are often landing, sometimes incorrectly or excessively on a part of their heel, like especially with runners, we see this very common in overstriding where the placement of the foot is too far ahead of their center of mass, and we're always trying to like bring that closer to reduce those forces. So if you're able to control, and here's the part with gait and assessing or addressing form is that it's not black and white, right? It's not a cookie cutter thing. There's a lot of complex things that have to happen when it comes to that person's balance, their stability, their strength, their experience level. So like just trying to get you into a new form isn't always like a magic fix. So I say that meaning even if we reduce the length of your stride or your step, if you still have poor control at your heel and you're not able to translate that force evenly, then we may need shoe. We may need to support the environment with something that gives it the right capacity or basically the amount of change that needs to happen so that they can keep up doing the activities that they love. So it can be kind of a twofold thing. I think, it depends on the person. But yeah, when we talk about like control at the heel, or how do we use the foot, sh the shoe wear, I'm sorry, to improve this environment of the foot, it can be extremely impactful for people who are in pain.
I definitely agree with that. And footwear is really one of the biggest modifiable factors in foot health, right? We can really choose what we put on our feet to help address some of the pathology. So, from your perspective, looking at shoes and prioritizing, when selecting a shoe, like what do you recommend? Like we always talk about stacking, right? And these new shoes, you look at like Hoka's or New Balance or some of the other shoes, they keep stacking their shoe. And with stacking, we mean the thickness of the shoe. At some point, stacking can be a problem, right? We stack it too high, it can lead to instability with runners as well. Then looking at the drop, right? We look at it, the drop in the shoe from the heel to the forefoot. Can you somehow, give us your perspective on selecting shoes and how they should really go about selecting a good shoe and maybe focus on if you're a pronator or a supinator, looking at what are the benefits and what's best for that?
Yeah, I mean, I should go out and be fully transparent too. Like a shoe is just a tool, right? Like I've existed on both ends of the spectrum. Like I've ran in the woods barefoot. I've also ran a marathon in carbon plated shoes. So like at the end of the day, you have to choose a tool that supports the demands of what you're trying to do. Like if you just want to be able to walk around the house without pain anymore, like that tool is going to look a lot different than somebody who wants to work out 5, 6 times a week in a gym and train for a race. Like you're probably going to need a couple different tools. So when I'm taking my clients through shoe selection or like what's going to be the best shoe for you, first it has to meet the demands of what you're trying to do, right? Like that's why soccer cleats are good for soccer, right? Like we need to be able to have that tool to implement that activity. So we got to make sure that the shoe that you're using matches the demand of the activity that you want, because often I'll see, and especially with this pendulum swing of high stack and high cushion shoe wears, I'm seeing a lot of people go to the gym in these shoes, and it's really robbing them of their ability to feel the ground. It's a shoe that's meant to run forward, not cut and move and laterally, do lunges and step ups and things where your foot really needs to feel the ground. So I think just making sure that your shoe design or the type of shoe that you're going to use matches the type of activity that you're going to do is a good starting point for most people.
Yeah, and I agree 100% with that, and we have two schools of thoughts too. We have like the minimalist approach to running shoes or shoes, and then we have the old school approach where we're talking about, a regular shoe, like a stiffer shoe, like a New Balance and things like that. So what are your thoughts on minimalist shoes versus like the standard shoe they see in a shoe store, like, Asics, New Balance? I keep naming brands, but that's kind of, I think, what the people normally see in the store. But a minimalist shoe is like a zero drop shoe, really not that supportive. Like, what are your thoughts on that when you're looking at choosing the right shoe?
Yeah, great point, right? Less shoe, zero drop means you got to work harder. Like that, at the end of the day, if you have less shoe underneath your foot, you better really own how you pronate, supinate, push through your foot. You hopefully you don't have a lot of issues like at your toe or your ankle or a lot of like a lot of certain things, because it's going to make you work a lot harder, and that is going to ultimately potentially have the risk of you being in more pain because there's less shoe there. It means you're working a lot harder to stabilize on the ground. If you don't have those issues, I would recommend having something that's close to the ground, depending on what you're trying to do, right? Like if you're trying to do trail running, maybe don't start there, right? Because you could just really bang your foot up and be left with a lot of other issues. And then again, too, I think we're coming back to how do you function? What is the baseline of your function of your foot and ankle? Do you have a lot of mobility restrictions, so you're just a really tight and stiff foot? Or are you over here where mobility is not your issue at all? You have a lot of stability problems. Now that's usually the basis of like deciding what type of shoe you need. And then when we base it off of your activity and what the demands are, that'll help us refine it a little bit more. So it's not like everybody should have a barefoot shoe, everybody should have high stack cushion shoes. I think there's even times when you can have a little bit of both, just depending on what you're doing. But yeah, the function of your foot is probably the most important role.
I agree. And talking about function of the foot, we could talk about pathology too, right? So for pathology like plantar fasciitis or Achilles tendonitis or like a posterior tibial tendonitis, all these itises are inflammations of tendons that help stabilize the foot. But some of those the shoe gear you choose can contribute to that or also correct that, correct?
Yeah, absolutely. Yeah, I mean, I was just thinking of a young basketball player that I was working with last week, a lot of peroneal tendonitis, and her issues were lack of, she's young, so she shouldn't, and she doesn't have any mobility restrictions, right? She's not somebody who's like a stiff foot and is creating a lot of compensations. She's got a lot of instability. So I had to have a conversation with a mother on like, hey, for basketball, we probably want to try to shoot up for like a high top shoe rather than a low top, just to give her some extra stability on the court with all this side to side movement. And that was kind of a light bulb moment for her, right? Like, of course, we can use the shoe as a tool to implement more stability for something that's being exacerbated by an unstable ankle, right? And on the opposite side is like somebody who's got really stiff ankle, high arches. Sometimes we may want a less supportive shoe so that they can really feel the earth and they're not slamming around their house like, oh, here comes Adam. I can hear him from a mile away.
Yeah.
Like I've had people with just really stiff ankles that like, yeah, when I walk down the stairs, my wife yells at me because she can hear me. And it's like, well, we probably want to help support your foot loosen up, like gain some more mobility from this. And if we can feel the earth better, then that's gonna help, soften your impact.
Yeah, we always say comfort over fashion is the key, right? I mean, these kids want to wear these fashionable shoes and playing basketball. They see all the pros wearing different shoes, and that might not be the right choice for them. And like you're talking about that patient with the flexible foot, I'm assuming it's pronation that's leading to the flexible foot. The peroneals might fire a little more to try to stabilize and combat the posterior tibial tendon firing, so they're kind of combating each other to balance out the foot there. And so where does physical therapy come to play with the pathology we're talking about? Like, for the peroneal tendonitis, the flat foot, plantar fasciitis, all that stuff. I'm sure as the physical therapy part of your practice, not only with the running side, but also working with them to, hey, this is what we have to do to strengthen these areas to help stabilize the platform that they're going on.
Yeah, and it all kind of comes back to like length of time, like when did things, really start going downhill. Because we're creatures of habit. We're gonna tend to try to like, let me just wait and see. I'll rest this week. Maybe I'll just ice it. I'll elevate it. I'll kind of just take it easy and see how things evolve. And I would say by the time most people are actually reaching out to a physical therapist to get help, it's probably been going on for a month, if not more. So timing is crucial, right? Because pain is, although common, like we're going to experience pain in our life, it's not normal, right? It's not a normal sign to be walking around in pain day after day. So, like, I feel like in the week to 2 week range is when things should be, getting a look at because you don't want that to snowball into something else and then just potentially lose time, especially if you're trying to train for something or you're just looking to stay active. So I think timing is a big concern. And then the other piece to that is helping you identify, is this problem more of a mobility issue or a stability issue? Because um, that category looks very different, right? Like if somebody's having a lot of stiffness in their ankle, and their Achilles tendon is just really, really inflamed and swollen, then we need to treat that mobility at the ankle joint and potentially the big toe and other spots to help that. Versus somebody who's got a ton of ankle mobility and they land in like an excessive amount of supination and then they throw themselves into pronation. That's a very unstable foot. We don't want to overstretch something that's already flexible. We want to stabilize and strengthen that.
Correct.
So I think it's just helping that person understand which kind of side of the coin do you fit on, because sometimes they play a little bit on each other. And to be honest, if we're going to do some mobility work, we're probably going to follow it up with strength and stability anyways. But we want to make sure that we open the window from the right standpoint, so that way everything else falls in line 1 week, 2 week, 2 months down the road. So you're just not wasting more time.
No, and I think you bring up some great points. So, number one, I think, no pain is normal, right? And people usually experience pain. They think it's normal, it's going to get better. And the sooner that we can recognize that it's correctable with being more aggressive with physical therapy or seeing a specialist is important. And the other thing, which I think makes you unique in your provider standpoint, is you really understand the biomechanics of what's going on. And I think a lot of practitioners, whether they're physical therapists or even podiatrists, really don't address biomechanics. I think that the majority of foot pain that we see, whether it's surgical or non-surgical, is always related to biomechanics. And I think that if we can address the biomechanical side, so there's two problems, right? There's the cause and the problem. So if patient comes in with, like you said, like Achilles tendonitis, so that's the problem. But what's causing it, right? We know that pronation causes that, short of the stride. They're rolling off their foot, they're doing adductory twist to push off, things like that. All these things are contributing to that pathology, but it's really biomechanics, right? The problem is the focus on the Achilles tendonitis, but really have to focus on the cause, which is the biomechanics. Is that correct?
Yeah, absolutely, right? Like the most common cause of an injury is the load that you were trying to do exceeded the capacity of your joints, tendons, muscles, tissues, right? Like something gave away. And then it's not always like you stepped off a curb and you twisted your ankle. That's pretty obvious. But in most of the people that we're seeing, these are issues that just happen a little bit over time, day to day, week to month, and then something gives, and then they're like, well, my Achilles hurts. Like I didn't do anything. That's always like the hard part is that there's nothing that actually happened to cause the injury. It's just a mechanical shift of load over time. And then that Achilles wore out because it was doing too much and everything else wasn't doing their job.
So I guess people that are listening and at home, like if they're suffering some of these issues, like we talked about, I know we talked about, the biomechanics, shoe gear, and how should we adjust these things and address things because no pain is normal. So if someone's at home and saying, listen, I'm experiencing like let's say plantar fasciitis, like what are some things that they can do at home to try to alleviate some of these symptoms before they come to see a person like you?
Yeah, I mean, I would say just stand barefoot on the floor with your feet underneath you, close your eyes and get a sense of like where are you actually putting weight down in your foot? Like are you, especially the foot that's in pain, right? Like are you bearing weight to the outside of your foot and you just feel so much mapped out on the pinky side of your foot, or maybe you're actually really into your big toe, like kind of trying to understand with your mind's eye, like what's going on down there, right? Because that could give you a little bit of a glimpse as to like, are you even standing symmetrically? Like, is there some asymmetry that's happening? Because if you can identify that, you can only explain it to a provider a lot easier. And then we can kind of jump right into like, okay, let's look at like what's going on with that. The second piece would just be like, how do you balance? Can you balance on one leg and close your eyes and maintain that for 10 seconds? Because that's honestly a little bit of a gold standard with when we're doing a movement exam to see head to toe what could be contributing to your pain, what could just be a red herring, meaning like you just have some mobility or stability issues that are not contributing to this, but we should keep our eyes on it. But if you can't stand on one leg with your eyes closed for 10 seconds, or it's extremely hard, I mean, balance is a great place to start. It's like starting to work on, okay, every time you brush your teeth or you're waiting for your coffee to, finish up, like how can you sneak movement snacks into your day to just start working on some of your own stability at your foot?
Yeah, and that kind of confirms like, addressing the problem and the cause, right? The problem's plantar fasciitis, but the cause is something more specific and it requires more of an experienced provider to figure that out and understand that and address that. Like for instance, plantar fasciitis, what I see in my practice, a lot of people come in with lateral column pain in their foot, right? Well, why is that? Because they're favoring the outside of their foot because their foot hurts on the inside. And people don't think about that logically because subconsciously when they walk they're loading that lateral column because they have the medial pain and they think their body's going, well, we're going to take pressure off that and work to then come out with lateral foot pain, right? They come out with some peroneal tendon pain or even insertional peroneal brevis pain, even sometimes the ATF or the CFL ligaments irritated too, because now they're stretching that, walking on their outside of their foot a lot. So understanding the pathology, linking to what's causing it as well, kind of work together to understand the problem. And once you resolve the plantar fasciitis, that lateral column pain goes away over time, combined with physical therapy, because I think physical therapy is a great adjunct to whatever we do in our practice, whether it's, any type of itis, or because you guys are great at addressing biomechanics and stabilizing that platform as they progress to walk and as they improve with their pain. I think that's important, and then, looking at that, like, so someone who's a runner, looking at runners or maybe these weekend warriors, what are some specific recommendations you would give somebody like that who's starting out, or even experienced runners, like if they are, you know, having some type of issue, like what type of recommendations would you give them, to evaluate? I know you gave a bunch of information about, looking at stabilizing the platform and, doing that spatial recognition of where your foot is in space, things like that. What other things would you recommend these people do as almost like a, let's say, prevention standpoint?
Yeah, number one, like if you're working out, you're active, you're running, is honor your schedule, right? Like don't add new things in that you don't necessarily need, because like the number one, I would say number one contributing factor to new injuries in active people is change in loads that happen too fast, too quick, or without enough like build up and change, right? So um, whether you're coming from the couch and you're looking to start something, like start slow, give yourself some time. Or if you're somebody who's like, I run 30 miles a week, I work out 4 to 5 times a week, you probably don't need to make aggressive changes. You probably just need to dial in a little bit of like the quality of what you're doing. So I would just like honor your schedule, like not making really intense changes to anything so that you don't uh, get in the environment of an injury. And then second is like, again, just coming back to your kind of movement capacity or your capability. I would say like, okay, can you balance on one leg? Can you squat and stabilize on one leg? How's your calf raise? Like, can you push through your foot? Or you have like good calf strength, right? That's like the powerhouse when it comes to um, everything below the knee, especially with running and shock absorption. And then I would also say like just your kind of step count. Like what are you doing every day to just walk? Like walking is so important, and it's low-hanging fruit, right? Like it's just so easy to get some steps underneath your belt, and kind of maybe even just take an audit of like how many steps are you taking over January? Like what did you do in January? Could we bump that up a little bit in this month? And then get it to a comfortable position where you feel like you're walking as much as you can do in your schedule. And you're probably going to be a little bit above the average person, to be honest, So just
Yeah.
walking is so important.
Listen, walking is important. We talk about, especially we deal, like in our practice, we deal with diabetics, we deal with, elderly people who are inactive, and, just getting out and walking. Walking is probably the best exercise you could ever do. And I think it's great that you monitor step counts is important, especially these days with the technology out there, right? You can monitor your step counts, you can see how many steps you do, and set goals for yourself. Like, today you did, I don't know, 1,000 steps. You want to do 2,000, or 10,000 steps. And believe it or not, 30 minutes a day of exercise, walking is great. People who are diabetic, and diabetics, we say diet and exercise, that works with physical therapy as well. As diabetics are as a population that we see who sometimes they're inactive, and getting them moving, and physical therapy helps with that, whether it's balance issues, stability training, increasing movement, range of motion, all that stuff is important to allow them to exercise, allow them to get out, and do their activity, get out and walk, because we know that exercise and diet are two of the most important things. Talking about exercise today helps control their blood sugar, which then alleviates complications associated, with diabetes, which is great. I think step count is great, and you guys are also great in fall prevention and gait retraining and activity modifications. I think you mentioned a lot of that as
Mhm.
well, which is important when it comes to not only the specific population of high risk patients like diabetics, but also runners and people who are just starting exercise, and also older adults, is getting some of that training and education, I'd say, from physical therapists like yourself to get started and motivated back to activity.
Yeah. One thing I should add that, I think all individuals can take from kind of the diabetic realm of like how we manage people with diabetes is like foot checks, right? Like that's such a important thing. We wash our hands every single day, so we're always looking at them, but like how often do we like pull our foot up and kind of inspect our toes, look at things, look at the skin? That's just like a super helpful way to like you're getting some basic flexibility from your hip, your knee, and your ankle every time you pull your foot up onto your lap, right? You're also checking, especially if you're a runner, like we need to have good cut toenails, like, right? That's just like, I can't tell you how many lost toenails and toenail issues I've seen because of improper care, right? And it's like if we just took a little bit of the base knowledge of what most diabetic people need to do with the foot checks, that's so important. It's like, well, why aren't we just doing that once a day? It takes 1 minute, right?
Yep.
So that's just that's the hanging fruit.
That's cool, and I'm actually take that phrase. Takes 1 minute to look at your feet. It does, and that's cool that you said that because I think as physical therapists they don't say that enough, and they really focus on other things. But I think focusing on diabetic foot check, but everyone should check their feet. Like you said, runners get the thickened, darkened toenail that falls off, whatever, and checking your feet daily is really important. For blisters to high pressure areas are causing issues, and there's simple ways that we can fix that with they call it runner's glue, where they can rub it on their feet or moleskin or whatever to address those issues. And as we start out this new year, I think like we talk about like 5 actionable things that we should implement. Like you said, number one, I think is regular foot self checks. I like that 1 minute check. We call it like the 1 minute. I think it's cool to say something like, I'll come up with something, but a 1 minute check is take 1 minute out of your day to check your feet is really important. And I think that's great, and also replace worn shoes. And this is a common question that I have, probably you do too, is like how frequently should you change your shoes? Is it like for someone who's running, let's say, uh, what, like 15 miles a week or something like that? Like when should they really like change their shoes?
Yeah, I mean, with the most technology and stuff like that, like Garmin's, Coros, Strava, you can track mileage on your shoes, which is great. I've tended to notice experientially that between 200 to 300 miles, sometimes my shoes are starting to kind of wear, and it seems like a little low for some models, but it kind of tends to seem to be like around 300 miles, maybe a little bit less is when most people are wearing that out. So that depends, like if you're somebody who's training for marathons, that could be every 3 months, right? Like that could happen pretty quick. Some people maybe 5 to 6 months. And it's funny, when you talk to people about like when they should change their shoes, most people kind of know. They're like, yeah, I probably should have gotten like new shoes by now. And it's like, as soon as you have the conversation with somebody, that most people kind of acknowledge that, like, yeah, I'm probably like a month or two behind.
Right.
And not that we want to like buy new shoes every 2 months, right? We don't want to like overdo it. But I would say if you're a very active person, shoes are tools to your toolkit. So like you probably should have a couple pairs of tools in your toolkit to like rotate through. So like you're not doing the same thing over and over through one pair. So um, yeah, I mean it's like, you know, at the end of the day, do you want to just bang your feet up and have some really rough tools, or do you want to kind of keep them in good shape? I would recommend then having a couple pairs and keeping tabs on, like I know some of my clients even write the date that they got them on the sole. They just know like, okay,
Great idea.
after about 3 or 4 months, I'm gonna probably be looking to change these if I've been, walking them every single day and doing activities. So
Yeah, and it's funny too because you speak to runners all the time, and I do as well. And they're like, "Oh, I started to get plantar fasciitis, or I started to get Achilles tendon pain." And you look at their shoes, and you're like, "Well, how long you had your shoes for?" And like, "I've had them for 6 months." And you're like, "Well, I think if you get a new pair of shoes, that's going to be a huge game changer for you." And you see them back in about 6 weeks, and they're like, "I got new shoes, and now my foot pain is 100% improved." And it's important that these shoes do only have a certain life, and after that they really have to be reevaluated, especially for running, right? Like everyday use is fine, but running is really, and I really like how you use it as an equipment, right? Just like any sport, whether you're playing baseball, football, field hockey, tennis, or whatever, it's equipment, right? And Like when your tennis balls, the air goes out, you got to get new tennis balls, right? So you buy, but people don't think of running shoes that way sometimes. They don't think of it as equipment. And running is a sport, and you should really think of it as an equipment. And it's important to replace that equipment when needed.
Yeah. Yeah, totally. Yeah. It's funny that the foot's kind of maybe just not held to the same like kind of standard as the rest of our body, right? Like
Right.
it's interesting in some ways, but maybe because they're just so far away. It's just like
Listen,
not like
we
a
always
pen.
forget about the feet, especially us. You know, we're the people they come to at their last resort with pain, right? They always think, oh, my foot pain's going to go away, but you know, if they have shoulder pain or hip pain or back pain, they're going to get that checked out right away. It's kind of like, you know, it's like you said, it's so far away, people forget about it and think it's going to get better over time, and they usually come see us when it's been there for 6 months, and it's like, oh, if you came 2 or 3 months ago, it would have been fixed a lot sooner and quicker. And then we look at injections, NSAIDs, orthotics, and PT. And I really think that, with any ailment that has to do with the foot, I think physical therapy and podiatry work really well hand in hand together to get people pain free and running again or back to whatever activity they're doing. And, you know, the last thing I want to say is, and like we said earlier, and I really want to stress is that, it's really important to address pain early, right? Not late, because the longer you wait, the harder it is to get to where they want to be. But you get them there, but it just takes a little longer because we know when inflammation lingers, it's harder to treat. I always tell people the story of plantar fasciitis. There's the two different kinds. It's the itis and the osis, right? The plantar fasciitis is the acute problem. And the longer it sits, then it becomes plantar fasciosis, which is just the thickened, inflamed banded band there that the body's basically like, I tried to fight this, but it's not getting any better. So we're just going to ignore it and let it be. And that's why when they come to see us, and I really think that addressing pain earlier with any ailment that happens in the foot or ankle is really important to guarantee yourself a quicker recovery.
Yeah, 100%. I couldn't agree more. Yeah.
Yeah. So, listen, I think that, number one, healthy feet aren't accidental and they're built through consistent habits. And I think that's what we kind of summed up today with is doing that. So I think now we want to open up the floor to anybody if they have any questions for, myself or Dr. Peters. We'd be more than willing to answer any questions for you.
Yep.
I have a question.
Okay.
I was okay. You can hear me. As far as diabetes goes, I know we talk about diabetic wounds on the feet, but what about healing from heel spur, with diabetes? Is that kind of
So,
similar to
bas-
healing a diabetic wound?
so you basically have a heel spur
Yeah.
and there's no wound though, correct?
No.
Yeah. So a heel spur is common for anybody, not just being diabetic, number one, and it is on the back of the heel or the bottom of the heel.
Bottom.
The bottom, yeah. So normally when you have a heel spur, it's really not the problem that's causing the issue. If you have plantar fasciitis, some people say you have heel spurs, but really it's just inflammation of the fascial band. A heel spur is normal to have. People have them. They could be asymptomatic or symptomatic, depending on who it is. And we kind of just leave that heel spur alone and address really the banded tissue, which is the inflammation going on, usually plantar fasciitis. I don't know if Dr. Peters wants to expand on that at all.
Yeah, right. It's simply like the SAID principle, right? Specific adaptations to impose demand. So like your body's going to lay down tissue where it's had increased pressure, tightness, wear and tear, whatever you want to call it, right? So like what Dr. Tiquin's saying here is that the bone spur is there. It's probably not the real problem. It's probably more so about how does your arch of your foot contract, relax, because that's what's pulling on that plantar fascia, which is attached to that area of your bone. So looking at how that function helps you stand, balance, and walk is probably what I would start with, right? Like just to look at how do we address this from a functional standpoint rather than just being boxed in on, well, this is what shows up on the image.
Yeah,
Yeah,
exactly.
because it is currently hurting me, and that's what I was wondering, if is having diabetes a problem that will lead to it not healing as quickly as somebody without the diabetes?
No, as long as you're a controlled diabetic, your blood sugar is controlled. I mean, people think that diabetes is like, going to affect a lot of things. Yes, it can affect things, but uncontrolled diabetes is really where it affects a lot of things. So if you're a controlled diabetic, you have the same chance of recovering as someone who's not diabetic. We just have to be cautious if we're treating it like giving you a steroid injection and things like that. We just have to monitor your sugar a little more closely. But other than that, the chance of recovering from something like plantar fasciitis is the same success as someone who's not diabetic, as long as you're addressing it in a timely manner and you follow the steps like, going to physical therapy, using orthotics, stretching, and maybe some adjunctive treatments like injections and night splints and things like that. But other than that, you have the same opportunity to heal as someone who's not diabetic. So don't take being diabetic, a controlled diabetic, as a negative thing on impacting things that normally occur in everybody else.
Okay. Yeah, it's controlled, and thanks for the info. It at least helps me out knowing that it's not going to get problematic or yeah.
Yeah, and I don't know if you're a patient of ours or not. If you want to come and get evaluated, make an
Yeah.
appointment, we can definitely see you, and we can definitely treat that for you. Combined with physical therapy, I think you'll have a great success.
Okay. Yeah, I'll make an appointment.
Please do. So, any other questions? All right. Well, if you have any other questions or concerns, you're more than welcome to email us, and we can answer those questions through an email or schedule an appointment with us as well. So, Ryan, I'll open up the floor. I don't know if you have any closing thoughts that you want to say here.
Yeah, so my offices are, I'm not in the Lehigh. I don't know if that was apparent that I'm not necessarily in your backyard, but I have worked with a number of clients remotely and virtually. So if there were things that you wanted to look at that like are foot ankle related or things that impact your activity level, you can find me at yourpathtomovement.com. And also for all the people who are in this, we're going to raffle just kind of like a free consultation with myself. So that could be in person or virtually through Zoom like this. There's actually a lot of things that we can do when it comes to just assessing your movement and giving you some clear, actionable steps. My offices are in Bryn Mawr and Swarthmore if you're not able to come in person. So we'll make sure that we pick one of you out of a random generator and can email that information to you. So.
And also, we'll whoever signed up will send an email out to the people with Dr. Ryan Peters' contact information as well in his office location. And I think virtual appointments are definitely the way to go these days, especially for what Ryan does. If you're unable to go in, I definitely think it's a great avenue to do. So, I want to thank everybody for number one, getting on the call. I know it's during their lunch hour. And also, I want to thank Dr. Peters for sharing his expertise and also practical strategies. I think it's cool that, and unique that the biomechanics role is really where he specializes in understanding that. And that's really important when especially what he does with runners and creating all these running plans for people if they want to start running or if they're experienced runners as well. I always enjoy talking to him and having these conversations. It's kind of, I guess we can call it geeking out on biomechanics and talking about that stuff is pretty cool to me. I enjoy biomechanics myself and really something that I like to specialize in, and so, a key takeaway too is, you really want people to invest in their foot health is really where it is. And, also investing in your total body health, longevity, and performance is important. And that's where I think that nice relationship comes in with us and people like, Dr. Peters and himself and combining that together. So, if you guys have any follow-up questions or, want to get any more clinical guidance, feel free to reach out to any of us at our offices. Like I said, we'll send out, some information at the end of this seminar. And also, thank you guys for joining us. This is our first webinar. New year, new feet, building healthy foot habits for, years ahead. And, we look forward to a healthy, active, and pain-free 2026. And like we said, we always start from the ground up, right? Being podiatrists and understanding runners and their activities, we always look from the ground up and how it affects the rest of the body. So thank you everybody for getting on today, and thank you to Dr. Ryan Peters for being on our first webinar today, and hopefully he'll join us again for some more informative sessions.
Absolutely. Thank you, Adam. It was nice to nerd out with you this
Awesome,
afternoon.
man. I appreciate it, man. Great.
All
Have
right.
a good one.
All right. Have a good one, everyone. Bye.
Yep.